Good afternoon, ladies and gentlemen. Our webinar is beginning. I'm Steve Love, President, CEO of the Dallas-Fort Worth Hospital Council. We thank all of you for being here today for this educational webinar. It's hosted in coordination with the University of North Texas Health Science Center at Fort Worth, who is an associate member of the council. Today, we've got an exciting topic, bringing innovation and entrepreneurship to nursing. This is a great topic, and we've got an accomplished speaker to address this during this webinar. We're going to talk about new technologies, new ideas, and new strategies to address critical health concerns in our profession. Our speaker today is Dr. Cindy Weston, the founding dean at the University of North Texas Health Science Center at Fort Worth College of Nursing. A long-time registered nurse and nurse practitioner in Texas, Dr. Weston also served as president of Texas Nurse Practitioners, the largest state nurse practitioners organization in the United States, have over 30,000 members. She's also a fellow of the American Association of Nurse Practitioners and the Academy of Nursing. Before we begin, I do want to say that if you have questions, please put them in the chat box or the question box, and we will make sure that we answer those. And I'm sure at the end of Dr. Weston's presentation, if there are additional questions, she'll be glad to answer them. So without any further ado, it is my privilege to turn this over to Dr. Cindy Weston.
Thank you so much, Steve. I appreciate that warm introduction, and I'm so delighted to be with you today. I have been a lifelong Texas resident, and in fact, I'm a sixth-generation Texan, and I'm just so happy to be here in North Texas and in Fort Worth after coming here from Central Texas, where I was at Texas A&M and launched a family nurse practitioner program with a focus of rural and medically underserved. And I joined the Health Science Center about a year ago, and for this incredible opportunity to launch a new college of nursing at a time where nurses are needed the most. And this focus that we have here at the Health Science Center is on innovation. I love this quote from Apple founder Steve Jobs. It really encapsulates my personal philosophy, but also what we're achieving here at the Health Science Center's new College of Nursing. Innovation springs from curiosity. If you're curious, you'll find a lot of things to be curious about, and then discovery follows. I grew up in a family in Southeast Texas, and my father was a pipe fitter. And when I was in grade school, he started his own business as a pipe bender and fabricator. He designed his own equipment, mostly because he couldn't afford to purchase anything that existed out there. And it was very successful, what he did for the refineries in the area. And it sparked in me that when there's a problem, you can identify a solution and you can make something happen. And I'm so pleased to be able to bring that now to the Health Science Center and really to nursing, the profession, and to the other nurses that will be here in the North Texas area. And it's with this innovation and curiosity that's embedded in my DNA that it's no surprise that here at the Health Science Center, it aligns perfectly with our values that were actually established years ago. The University of North Texas system established these 5 core values which shape everything we do, and we don't take them lightly. And you'll notice one of those core values is being curious. So how do we define curiosity here at the Health Science Center? We don't just define what it means, but we've developed behaviors that go around that, such as questioning the conventional, taking strategic risk, pursuing collaborative opportunities, again, all aligned with my personal DNA and exactly what we're doing here as we have developed our new College of Nursing. We are creating the next generation of nurse leaders, innovators, and entrepreneurs. We don't want our students to see the problems, but instead they will see the solutions, and they will find these solutions, implement these solutions for healthier communities in our Dallas-Fort Worth Metroplex, the state of Texas, and beyond. Being curious is really woven into the fabric of our nursing curriculum, and we are providing those opportunities for our students, and you'll see that it's also reflected in our faculty. But this week is Nurses Week, so I would be remiss not to talk about the impact that nurses have had in healthcare from its earliest beginnings in the mid-1800s with Florence Nightingale, Mary Seacole, if you've heard of her, both serving in the Crimean War. Nurses have been on the front lines, have witnessed the challenges, and are best poised to find those solutions to improve patient care. I've often wondered what Florence Nightingale would think of the profession of nursing today. She was the ultimate iconoclast, and by iconoclast, that's sort of thought of as a person who challenges the conventional. She was an innovator in its purest sense and showing us something new. Florence Nightingale's mission was to provide decent health care to everyone that she encountered. And if you know about her, she was raised in a very wealthy British family who were actually quite horrified when she volunteered to work in military hospitals during the Crimean War. And of course, once she was there, she realized that more soldiers were dying of infections caught in that hospital than their actual battle wounds. So she completely redesigned the setting and the way in which those soldiers were being cared for, which all led to better outcomes and, of course, set the trajectory of the profession of nursing. She was also one of the first to recognize that teamwork without hierarchy was essential in healthcare delivery. And she used data to drive everything that she did. She was one of the first, really, in what we would define today as evidence-based practice. In fact, Nightingale was eventually the first female inducted into the Royal Statistical Society because of her pioneering work in statistics and driving that data to impact outcomes. So for us here at the Health Science Center, being an innovator can mean disrupting conventionality as part of our value of be curious. But there are many, many other innovators in the field of nursing. Bessie Blount Griffin, who invented the feeding tube because she noticed that veterans she was caring for were becoming more debilitated because they could not consume the nutrition they needed to recover. She invented that feeding tube to give them that nutrition and, of course, found better outcomes as a result. Elise Sorensen invented ostomy bags and ostomy care as a source of dignity for individuals who had experienced a colectomy, removing a part of their colon and resulting in a colostomy. Before she invented those bags, there was significant impact on the individuals. And she implemented that. In fact, we have a whole specialty in nursing of wound ostomy that she started the pioneering toward. Anita Dorr, who was actually the first president of the Emergency Nurses Association, invented the crash cart. And she did this again as a solution to a problem during a code. Everyone was having to grab different equipment and supplies to resuscitate an individual. And she thought, I need a cart with everything in it at the time that we need it. And that defibrillator could sit right on top. So she actually constructed the cart on wheels and had her husband paint it in their basement. And of course, now we couldn't imagine a unit anywhere without its own crash cart. One of my contemporaries, Kathleen Bowman, invented what was known as the pronator. It's a device in which you can place a patient in prone positioning to increase oxygenation. We found that very valuable during the COVID-19 pandemic for patients we had struggling to oxygenate. Sharon Margone, who's right there in the center, actually invented the Billy Bonnet. It's this head-hugging device of eye mask for premature infants who need to undergo phototherapy for hyperbilirubinemia. It's a great little device that's used really across the country now. And in fact, it was a nurse who even invented phototherapy worked for infants with profound jaundice and hyperbilirubinemia. Sister Jean Ward found that when she took those infants out into the natural sunlight, those were the infants that were recovering from hyperbilirubinemia. But back to Sharon Margone, she couldn't find a hospital or a unit to invest in her product, so she invested $1,500 of her own finances to form this company to start a mass production and marketing. And now that same company has multiple products specifically geared to infants and premature infants and babies that is highly successful today because of her innovations. And in modern times, Abby Hess is at Cincinnati Children's, and she invented what's called the Hess anxiety relieving app that has become an evidence-based practice for children undergoing surgery of the toddler and preschool age in the pre-op and post-op phase. So innovation is just that process that brings creativity to measurable outcomes. And it's something new or something different that actually solves a problem. And here at the Health Science Center, we are preparing nurse innovators to take that creativity to their next level. So for the rest of our time today, though, I'd like to focus on these 4 pillars of innovation. The innovative foundation of the Health Science Center, our innovative faculty, the innovative format in which we're delivering our curriculums, and then the innovative funding we have for our first inaugural students that we will get this fall. These are 4 cornerstones that I'll cover in this presentation. The Health Science Center has a very proud history of fostering innovative solutions for the pressing healthcare problems. The very founding of the Texas College of Osteopathic Medicine ushered in a new era of healthcare for our state. And this was more than 50 years ago. 3 Fort Worth physicians had a vision to build an osteopathic medical school from scratch to deliver high quality healthcare, not just in Fort Worth, but beyond in our state. And since then, the Health Science Center now has 6 schools, with our latest being the College of Nursing, which we are also creating from scratch. And we're committed to continuing that legacy that was ushered in over 50 years ago, but now ensuring that our nurses are innovative leaders, building health communities that we need to help our communities prosper. This is building on the foundation of innovation at the Health Science Center with HSC Next. Many of you know about this program, but perhaps some of you don't. This is a unique program here at the Health Science Center in Fort Worth that guides innovators to develop and scale their healthcare solution for patients and providers. It can lead them on a journey toward patent or protection of intellectual property, also through entrepreneurship in scaling that solution wider. And it might not just be a product that they're developing, but it could be a healthcare delivery model. It could be a healthcare process that improves outcomes in patients and populations. So HSC Next works very closely with Techstars, Physical Health Fort Worth Accelerator, which exists here as a combination of the City of Fort Worth, Tarrant County, and the Health Science Center coming together to accelerate entrepreneurs from around the world to revolutionize healthcare, the healthcare industry, all through new technology. HSC Next is very technology focused, and we host about 10 Techstars each year. We're going on our 3rd year, and accelerate their ideas into fruition. So Techstars, again, supports and funds these early stage startups with new technologies or treatments or therapies in the space of physical health, such as rehabilitation, physical therapy, performance, and exercise. So I want to highlight just a couple of the past year's finalists, and there, again, were 10, but Somos was one of those. Smart Health is building health and wellness super app directed toward Latin Americans, starting with a version that aggregates body signals from glucose sensors, wearables, and lab tests to help people with prediabetes or diabetes understand how their body, their unique body, is reacting to food and habits. So this incredible app is synchronized to provide precision or individualized care. So an individual can either prevent diabetes, who has prediabetes, or manage and control their diabetes if they have that diagnosis. It's incredible. Another is the Comeback Mobility Smart Crutch tips. And I'm excited to show you a video for this particular product, but basically it's you apply the right tip of force in a recovering limb on their crutches at home, so that it's a solution that aids and speeds up recovery and reduces the number of revision surgeries that an individual might have. And I'm going to see if I can get this to play. Hopefully I can. And hopefully you can hear it. Whoops. If I don't press it too many times, I might be able to do it right. Oh, okay. It worked earlier. One more time. I think because I played it earlier. Let me try this.
Many lower extremity injuries have weight-bearing restrictions on the involved leg. Smart crutch tips, an accurate and objective measure to achieve this. How do they work? The doctor prescribes a weight-bearing program per patient's needs. No load, partial load, and increasing load. The patient receives a link to the program and opens it up in the patient app. Following instructions, the patient installs the smart crutch tips and syncs them to the app via Bluetooth. After pairing the devices, the specific weight-bearing program is activated. Now it is in the patient's phone and in the smart crutch tips. Step softer.
Step harder.
Step harder. There is no feedback when the patient is walking correctly. Data for each step is shown in the doctor dashboard and patient app. The patient can alert the doctor of pain or swelling via SOS button.
So you can see just incredibly creative products that are making a difference in health and healthcare. Who better than nurses who are on the front lines of healthcare, closest to the problems, to be closest to those solutions, and then to have the scaffolding of infrastructure that we have here at the Health Science Center to help scale an innovation into reality that could also benefit you, benefit your healthcare organizations. We also here at the Health Science Center have incredible resources through our Center for Human Identification. This is the DNA forensics lab and it was the initial one for the entire US. In fact, this lab boasts the discovery of more serial killers than anywhere else because of their ability for human identification. They're currently working very closely with the State Department and some human trafficking initiatives. But all of that exists on our campus. It's part of our Health Science Center, and the experts in this forensic DNA analysis are integrating it with our College of Nursing to bring a forensic nursing aspect to our college. We also have the North Texas Eye Research Institute, which is leading in visual science and ophthalmology research. Who does vision screening on the very front lines? It is nurses who are interacting with the scientists who are addressing research through our North Texas Eye Research Institute. We also have an Institute for Health Disparities here on our campus that focuses on preventative measures and research addressing chronic conditions such as diabetes, cardiovascular disease, cancer, stroke, HIV that predominantly address underrepresented populations. All of that will be integrated into our college, along with our Institute of Translational Research, which is the leading institute addressing Alzheimer's, Parkinson's, and other neurologic conditions. In fact, it is the most funded institute in the US addressing this particular population. We've already recruited onto our faculty some of the nurses who were front lines in that research with the lead investigator, Dr. Sid O'Brien. We have a Center for Health Policy that has 3 foundational pillars of research, education, and embracing the community. And through this, preparing nurses focused on policy and the impact of policy as it impacts health outcomes. And finally, our Center for Anatomical Sciences has long been established here at the Health Science Center. Our nurses, particularly at the graduate level, will have exposure to educational preparation through those resources. But I also wanted to recognize our innovative faculty, and I'll start with Dr. Elizabeth Wells-Beatty, our Senior Associate Dean. She's a national researcher in virtual reality as it pertains to health and simulation. She has some patents pending herself on virtual reality simulations that have been created not just to educate nurses, although that was an initial focus of her, but also a healthcare workforce and other utilities within virtual reality. I also wanted to spotlight Dr. Tony Chris Naka. Dr. Naka is our Associate Dean for Research and an expert in digital health, particularly as it addresses health disparities. He recently shared his expertise in digital health as an invited panelist to the 2024 VIV conference, which is a leading digital health technology conference in California. We're so grateful to have Dr. Naka and the work he's doing in digital health, digital care, and integration of AI into improving health and health outcomes. And our Assistant Dean for Clinical and Outreach Affairs is Dr. Kate Taylor. She's bringing innovation in direct care delivery models. She launched a home-based primary care delivery service for older adults through UNTHSC Center for Aging, and it's called House Calls. In addition, she also launched a very innovative clinic. It's 1 day a week that she does advanced care planning for individuals and families. Many times, individuals are forced to make very crucial decisions about their health during a crisis situation. Through advanced care planning, Dr. Taylor has created an avenue to walk through what all an individual's options could be so that they can make decisions at a time that they're not in crisis and their wishes can be respected. In addition, she's also strengthening our partnerships in clinical areas around the DFW Metroplex. She's looking at ways that our students can obtain clinical hours both in healthcare organizations and hospital systems, but also in our community. We've seen a 48% growth in the need for registered nurses in ambulatory and community-based care, while there's still a 40% growth in the need for acute care and tertiary quaternary care. So we are exploring our options in community-based and ambulatory care and being very strategic as we engage with healthcare systems and hospitals, meaning I believe we exist to fill the gaps in healthcare. So we're looking at very creative pipeline and pathway programs for areas of highest need in nursing. And that may be individual to your unique hospital or healthcare organization. For instance, several years ago, we saw a great need for perioperative care nursing. We can create a longitudinal clinical experience co-created together to develop a pipeline and pathway in peri-op where students would experience all the aspects of the peri-op continuum from pre-op to pre-op inpatient to ambulatory care pre-op visit to intra-op experience, post-op experience, even to home health follow-up visit, so that a nurse is very well prepared in the whole continuum of care to address a specific need of a healthcare organization to fill a specific pipeline for nurses. We hear a lot about med-surg. I view this as what has traditionally been called DEUs, dedicated education units. Many of you probably have those units and are preparing nurses through those units. I view this as DEU 2.0. These are smaller experiences with very targeted areas that you need nurses in, and we can partner together to co-create what those longitudinal experiences throughout their program would look like. So when they launch, they are practice ready, they're ready for your organization. So Dr. Taylor has been my lead in securing clinical affiliation agreements with our major hospital systems in North Texas. I think we have most of our hospital systems in a master agreement at least. And if you're not one of them, then let's talk, because we would love to partner with you and to create and specifically design clinical experiences around what your needs and capacity are. We already also have, actually it's over 30 agreements now in ambulatory care and community-based settings, which really gets back to the root of nursing and where we're seeing that growth in preparing registered nurses. I wanted to speak a little bit about the innovative format. Our students have the benefit of some of the best healthcare education facilities in an interprofessional education environment here at the Health Science Center with our 6 varied schools of health disciplines. But also, this includes our state-of-the-art regional simulation center. This center has the latest equipment in which our students train, a robust standardized patient program. And for those of you unfamiliar with that, that is like hired actors who portray patients with an evidence-based approach to enhance the interaction with individuals, develop communication skills. And then we also have an incredible augmented reality, virtual reality preparation environments within our simulation center. If you're interested in visiting our campus, I'd love to host you and tour you around some of these facilities, and we can talk more about partnerships and preparation of nurses. We've spent a good deal of time researching the greatest needs for nursing education with our clinical partners. Since I arrived July 1st, I've been engaging with different clinical partners as you have had capacity to meet with me. And if I haven't met with you, I would love to, so please reach out. But based on what we've heard, particularly as we had designed our Masters of Science in Nursing Practice Innovation program, we wanted to create and capitalize on this idea of a pathway for nurses to upskill, reskill, retool themselves so that they are retained in our profession. And what we saw after the pandemic was a mass retirement and exodus, not just from the unit on which they worked, but from the profession as a whole. We want nurses to know there are so many avenues of our profession in which you can practice, and we're providing a framework on which you can retool yourself. So some of those highest need areas are being integrated as specialized tracks into our MSN and nursing practice innovation. And we've developed 9 of these based off of what we heard as needs in our community, state, and state in particular. And that includes healthcare management. Through this, we will go through the finances of healthcare so that nurses really understand the economics of managing and running efficiently, effectively, safely a unit within the healthcare system and rising up to executive leadership within nursing. We've covered all of the core American Organization of Nurse Leadership competencies as we designed this particular program. One on substance use disorder, which we know is a high need and transcends really all areas of practice that anyone would be engaged in. And then a high need for correctional health or correctional care nursing pipelines. We know some of our large organizations within the Dallas-Fort Worth Metroplex deliver correctional health care through our county jails, but also we have federal prison facilities here, and they need nurses. They need nurses who are adeptly skilled at correctional health and providing optimal health in those settings. And these will also launch as certificate programs. So you don't have to be enrolled in a master's degree program with us. We will launch these as 4 3 credit hour courses starting this fall with healthcare management, substance use disorder, and correctional health. And then following in summer, we are adding an additional cohort that's also embedded in our master's program as options: health disparities and technology, which will go into digital health, digital care, AI, the intricacies of those as they address health disparities, chronic disease management, palliative care and hospice nursing, patient safety, public health nursing, and simulation in nursing, whether that's simulation in academic education or in healthcare organizational education to verify and maintain competency. But in addition, we wanted to create some micro-credentials for nurses. And the very first micro-credential that we're launching, because there's a high need for qualified preceptors, high need for additional nurse educators. And typically what happens is a nurse clinician is an expert clinician is oftentimes moved into roles of academics without really having any background or education in curriculum development design, assessment of competency, or evidence-based practice in education. So the I Teach micro-credential, innovation and training nurse educators in assessment, competency evaluation, and high-quality simulation will be launched this fall. And the goal of this is to prepare expert clinicians to be able to serve as nurse educators or support nurse preceptors to improve retention, particularly of our novice nurses. We want to grow the workforce with experienced and qualified nurse preceptors. If there's more teachers, there's more students, there's more preceptors, there's going to be more retention. So we're partnering with our Division of Academic Innovation for our instructional design expertise so that this is available and accessible online through active learning and an optional on-site experience in our simulation center. This collaboration will ensure that we're utilizing the best practices in education science, so we're meeting the needs of our learners. But here's the greatest news, is when we roll out the I Teach micro-credential, we can open that up to participants at no charge for our first year. So if your healthcare organization wants to engage with us in this opportunity, please reach out. We would love to connect you with the registration process as that is prepared and goes live this fall. But we're real excited to bring this to the community as well as to our profession. But the University of North Texas system has the most affordable tuition rates of any major public university system, for sure in Texas, but also I would venture to say the US. The Health Science Center at Fort Worth also has nursing scholarships and awards. We're very fortunate that will cover up to 100% of a student's out-of-pocket tuition cost for our first year. For our MSN in Practice Innovation, we are having our first cohort designated as Nurse Innovation Fellows. They will join us in this Nurse Innovation Fellowship program to provide our inaugural MSN students with up to $5,000 in tuition support each semester for their first year, making that first year tuition no cost to them. And these fellows will also have the opportunity to serve as peer mentors for other nurses so that we are inspiring the next generation of nurse innovators and leaders. So These pillars of innovation are the foundation of our exciting new degree programs launching this fall, the RN to BSN, and the MSN in Practice Innovation, which I've already spoken to, with our emphasis on innovation and the 9 specialty concentrates that those students would have the opportunity to select from. The BSN is very important to our community and to healthcare organizations because we know institutions that employ more bachelor's prepared registered nurses have higher nurse retention, less turnover, and we all know how expensive nurse turnover is. But they also, and most importantly, have improved patient outcomes. Hospitals that have at least 80% of the nursing staff with a bachelor's degree by any pathway have mortality rates about 25% lower than hospitals that only have 30% of their nurses with BSNs. That research dates way back 15 to 20 years, where Linda Aiken originally showed improved health outcomes with the more bachelor's prepared registered nurses within an organization. So I'm also pleased to say we're not stopping with the RN to BSN and the MSN and Practice Innovation. We will be launching a traditional BSN for pre-licensed to prepare newly licensed registered nurses fall of 25, and an MSN as a psychiatric mental health nurse practitioner, because we know our state needs mental health providers desperately. We have a mental health care access crisis in our state. So we want to be part of that solution by offering this incredible program with highly qualified faculty that will also thread that emphasis of substance use disorder into that program and provide our future healthcare providers. So our applications are open now. They close on July 1st of this year. So that's for our RN to BSN and our MSN in Nursing Practice Innovation. Please pass on to your nurses that first year's tuition, no cost, low cost. We would love to see them join us because there will be the flavor of innovation throughout all of our curriculums. So why now? Why at this moment? Why is innovation important in nursing? It's because we are emerging into the world of digital health, digital care, AI. You've already seen robotics, technology, and who better than nurses serving on the front lines to be equipped to relay those solutions and scale them up so that we can improve outcomes here, not just in North Texas, but beyond. History validates this, that 77% of mainstream inventions and innovations are all traced back to the initial users who needed the solution to the problem to begin with. Nurses are on the front lines. We are preparing those nurse innovators with the mindset to find the solutions for your healthcare organizations and for the needs of our community. And as the largest healthcare profession, we'll accomplish this and grow that opportunity for all nurses. If you want to learn more about our programs, you can find us at UNTHSC.edu/nursing. And if you have any questions, I would love to entertain those.
Excellent presentation, Cindy. We really, really appreciated this and very, very informative. You know, I did have a couple of questions that people sent me in advance. So I wanted to ask you a couple of those. What in your mind is the best thing hospitals and health systems in North Texas can do to help support nurse retention? I know you touched on this, but I didn't know if you could elaborate.
Oh, sure, I'd be happy to. There's data around this that nurses who have an opportunity to advance or professionally develop is a strong retention strategy for nurses. We saw this during the pandemic. Nurses just kind of reached their point, and it was like peace out. And it wasn't just, you know, they were gone from that particular unit. They some of them left the profession. So I think having opportunities of support by organizations to upskill, to reskill, to redesign themselves, opportunities of mobility within the organization are great retention strategies. And sometimes higher education is the pathway in which to do that. But also, we know that supportive administrators, there's a close link in having a leader that they're reporting to that has great leadership and management competencies. And that's one of the things that we're addressing with our healthcare management certificate, is to help managers be prepared to manage optimally. That is a strong source of retention, professional development for your leaders and your managers. Of course, compensation, we know that, but also nurses of today are looking for other things too, like flexibility and work schedules. So there's sort of a bucket list of retention strategies that organizations can employ, but I would emphasize that ability to receive higher education and promotion.
Great answer. You know, one of the first meetings we had with you was when the foundation brought together, our foundation brought together the deans of the nursing schools and the CNOs. So I know you hear this question frequently, but you've got a clean sheet of paper, so to speak. You're starting out and you've got your new nursing school. What are you doing in your program to ensure new nurses are practice ready?
That's a great question. We are very aware of the data. A study came out, Pat Sharpneck, and was one of the authors of that nurses graduating post-pandemic were 9%, only 9% of the graduates were practice ready. So we, our American Association of Colleges of Nursing had just come out with new competencies for nursing, Nursing has always been competency based, but moving them into very strategic. These are the competencies of the professional nurse at entry level, and these are the competencies of the professional nurse as they advance the graduate level. And we have had the opportunity to design our curriculum around these competencies. We have already mapped out all of these competencies at level 1 and level 2 throughout our undergraduate and graduate curriculums. We are embedding opportunities of assessment of those competencies throughout. And we're using a lot of simulation to validate those competencies in addition to those clinical hours. But I think a strong partnership with our clinical entities is a way to get nurses practice ready. I see gone are the days that we can just sit here and design a curriculum and say, here's the nurses. We have to co-create these things together. And we have to hear, what are your needs? And I believe that that's what this pipeline and pathway opportunity, and I've set aside funds for co-creation of positions so that we can work together to get these pipeline and pathway programs up that fill an exact need of your particular healthcare organization. I believe I'm calling it the DEU 2.0, but it's probably something even conceptually beyond that. So we need this relationship with our partners of what do you need? How do we co-create this and design it so that when those nurses launch, they're practice ready for you, but practice ready for the profession.
Thank you. Another question is kind of an unfair question, but do you view your role in your new nursing college competing with other colleges in North Texas and throughout the state, or do you view it more as we're all in this together?
Oh, Stephen, you know, the current data by the Texas Nursing Workforce Study shows that just in North Texas, we are 7,000 nurses short today. today. And that's with all of our programs that currently exist here in North Texas. So there is need for more. We have and I believe I've received a kind welcome from my colleagues in nursing programs. So we are all in this together, not just academic nursing programs, but I would say our healthcare organizations and entities. We're all in this together, and we need all of us working to help fill these vital needs in the healthcare workforce, particularly nursing, professional nursing.
Right. You know, you covered in your talk some excellent points, especially on innovation. Um, I don't see any further questions pending in the Q&A or in the chat, but if people that have participated today come up, you know, afterwards and have thoughts or ideas or suggestions for you and for your program, what's the best way for them to reach you?
Oh, I love that. You can reach me directly at it's gosh, nursing at UNTHSC.edu.
Well, you've done a fabulous job, and we can't thank you enough. I see no further questions pending, but I'm going to turn it back to you for you to give the final word before we conclude.
Oh, well, just thank you. I'm grateful to be in this community, and here at the Health Science Center, I think there was a strategic vision to launch a College of Nursing at the time that we need more nurses. And as a health-related institution, our nurses will come out with that interaction with interprofessional disciplines, ready to serve on teams, ready to address the healthcare problems that we're facing in our area today. So thank you for this opportunity to be here, and I look forward to meeting and serving our North Texas area alongside of you.
Thank you so much. And to all the participants, we thank you. Thank you for taking time to join us for this very educational webinar today. With that, we are adjourned, and everyone have a good rest of the day. Thank you.